Pregnancy. The process of pregnancy, labor and delivery impact a woman's future health and quality of life. Labor may be a significant biological process with several implications for the mother's health and the baby's well-being. Longer labor is associated with increased maternal and neonatal morbidity and mortality according to several research studies. In exercise of pregnancy, physical exercise is a common thing that pregnant women do in their free time. Studies have shown that it can have benefit on maternal and newborn health. In Barakat R et al. 2016, there are many benefits to exercise during pregnancy. Almost all women or pregnant women should start out by doing some form of exercise, especially if they are at higher risk of developing complications during their pregnancy. So that's all.
Hello, my name is Nurul Aisha binti Ali, matrix number D201910874439. Okay, I'm going to present about Article 1 entitled The Influence of Exercise Type on Maternal Blood Pressure Adaptation Throughout Pregnancy, that was written by Murphy S.E., Johnston C.A., Strom C. et al. 2021. Okay, for the introduction, it has been reported that 10% of all pregnancies are complicated by a hypertensive disorder of pregnancy. Previous research has shown that moderate vigorous intensity exercise has a positive effect on maternal resting blood pressure. Most of the previous studies solely focus on aerobic exercise. Okay, the objective of the study is to examine the effects of exercise types on maternal blood pressure throughout pregnancy. Okay, this study utilized 3 exercise intervention, which is aerobic exercise, resistance exercise, and combination, and compared the result with those of non-exercise control group. Aerobic exercise include training on treadmills, ellipticals, recumbent bicycles, rowing, stair-stepping equipment, while the resistance exercise include leg extension, leg curl, shoulder press, chest press, tricep extension, latissimus dorsi pull down, bicep curls, lateral shoulder raises, front shoulder raises, and resistance bands, dumbbells, exercise balls, and benches. Okay, the results of the study illustrate that any form of exercise, whether resistant, aerobic, or combination training, is effective in reducing blood pressure throughout pregnancy. After controlling for maternal body mass index, all 3 exercise types, which is combination, resistant, and aerobic, is significantly predicted a similar decrease in diastolic blood pressure that was maintained throughout pregnancy. Okay, for the conclusion, all exercise types were beneficial in lowering maternal resting blood pressure throughout pregnancy. Resistant training was noted to be the most beneficial in improving systolic blood pressure, followed by aerobic exercise. Okay, all 3 exercise groups were noted to improve diastolic blood pressure equally. For the recommendation, future research should include measurements of pro and anti-inflammatory markers and determinations of the association between these markers and maternal blood pressure throughout pregnancies, and also future research should focus on replicating the effects found in this study in women with high-risk pregnancies, including those with pre-existing diabetes, chronic hypertension, or obesity.
So, in second article, the title are moderate intensity aerobic exercise during pregnancy and 1 month infant mortality. So, in introduction in this article, they generally talk about the health of neonate in early postnatal period that influence their lifelong predisposition to obesity. So, thus investigating the impact of supervised exercise during pregnancy of neonatal tissue composition beyond birth may provide stronger evidence for its impact on the risk of future obesity. Their objective is to assess the effect of supervised prenatal aerobic exercise intervention on 1-month-old neonatal mortality. So, in this study, there are considered 2 groups, which is aerobic exercise group and non-exercising group. So, before they start the session, they begin with 5-minute warm-up and end with a 5-minute cool-down. The aerobic exercise was performed using treadmill, elliptical machine, stationary bicycle, rowing, and or stair-stepping equipment. And for the non-exercise group, they were offered with opportunity to attend low intensity, 40% below for VO2 peak, stretching session that focus on standing or sitting stretch of major muscle group while incorporating breathing technique. The result in this study found there are no appreciable effect for prenatal exercise and neonatal weight. Side surface skin fold thickness like bicep and subscapular, abdominal and mid-upper arm circumference, and fat-free mass. Regarding neonatal weight, the lack of specific of this metric measure likely to lead to the null observation. For the conclusion in this study, suggests that aerobic exercise has a beneficial impact on neonatal skin fold thickness and percent body fat at 1 month of age.
Hi, my name is Muhammad Rizwan bin Ali, number matrix D201910903222. Today I will present to you about my article number 3, that is exercise during pregnancy, improve maternal glucose screen at 24 to 28 weeks, a randomized control trial by Barakat et al. 2014. Okay, for the introduction, physical activity, that is PA, may contribute to the prevention of exercise, maternal weight gain, and thus is crucial for dissecting the vicious circle involving gestational diabetes mellitus, that is GDM, childhood obesity and adulthood obesity and diabetes. In Motola opinions, the true effectiveness of specific structured exercise programs remains untapped in GDM prevention. Okay, for the second, that is objective. The objective is maternal glucose tolerance was examined in relation to the effect of an exercise program carried out by healthy pregnant women. For the intervention, 35 to 45 minutes sessions are performed 3 times a week, that is Monday, Wednesday, and Friday, with 2 land aerobic sessions and 1 aquatic activity sessions. This conducted from the start of the pregnancy, that is from week 6 to 9, to the end of the 3rd trimester, that is weeks 38 to 39. Each sessions include 25-minute core sessions, which was preceded and followed by a gradual warm-up and cool-down period of most muscle groups, that is from upper and lower limbs, neck, and trunk muscles. The cool-down period also included relaxation and pelvic floor exercise. Aquatic workouts include swimming laps, running, walking, and jogging around the pool, as well as stretchings, lunges, step climbs, cross-country skiing, motions, and strength training in the water. For the purpose of strengthening muscles, aquatic equipment such as noodles, float, and light-resistant gloves were also used in the water. The temperature of the water was between 28 and 29 degrees Celsius, and particular precautions were made to prevent infections. The main advantage of exercising in water was to avoid a large impact. Okay, next is for the result. There is a significant difference was found between study groups on the 50-gram maternal glucose screens MGS. Values corresponding to the exercise group were better than those of the control group, that is P equal to 0.000. In addition, no difference in maternal weight gain and no cases of gestational diabetes in exercise group versus 3 in control group, that is 7%. Okay, for the conclusion, a modest exercise routine during pregnancy increased the mother's abilities to tolerate glucose. Okay, that's all from me. I will pass to the next presenter.
Good evening, Doctor. My name is Shamina Binti Osman. My matric number is D201910874447. So I'm going to present 2 articles, Article 4 and 5. For Article 4, the title is Effect of Aerobic Water Exercise During Pregnancy on Epidural Use and PIN, a multi-center randomized control trial by Carrascosa et al. In 2021. And the objective of this study is to analyze the effectiveness and safety of moderate aerobic water exercise by pregnant women on the subsequent use of epidural analgesia during labor, induction of labor, mode of delivery, and pain perception. In this study, 320 pregnant women were randomly assigned, and average of them are 14 to 20 weeks of gestation, who are considered to have a low risk of pregnant complications, and they were divided into 2 groups, which is the control group and exercise group. And both groups will receive usual antenatal care. However, exercise group will receive practice moderate aquatic aerobic exercise. And the gynecologist and anesthesiologist also midwife who assisted the woman during labor were blinded to group allocation. The results of this study is how it's stated on the slide, and the 2 groups, moderate aquatic aerobics exercise versus usual antenatal care, should know or newborn adverse events. And to be concluded, aquatic aerobic exercise during pregnancy had no effect on the use of epidural analgesia during labor, whereas pain perception was lower after aquatic exercise compared to usual care in pregnancy. The intervention was safe for pregnant women and their newborns. The recommendation in this study, further confirmatory studies are needed to analyze the association between exercise and pain perception during childbirth, and qualitative studies are needed to determine the expectations and knowledge of pregnant women regarding pain relief during childbirth. Next, Article 5. The article titled Exercise During Pregnancy is Associated with a Shorter Duration Labor, Randomized Clinical Trial by Barakat et al. 2018. The objective of this study is to examine the influence of an exercise program throughout pregnancy on the duration of labor in healthy pregnant women. Along with this study, there is 508 healthy pregnant women that be recorded in between 9 to 11 weeks of gestation that randomly assigned. They were divided into two groups. The first one is a control group and the second one is exercise group, which in a control group and exercise group, they receive similar standard of care. However, in exercise group, they perform an exercise program throughout the pregnancy that included gradual warm-up, aerobics resistance, like muscle strengthening, coordination and balance exercises, stretching exercises, pelvic floor strengthening, and relaxation of final talk. This study came up with a result. The total duration of the labor, the first, second, and third stage was significantly shorter in the intervention group compared to the control group, which 450 versus 507 minutes with p-value equal to 0.01. Very statistically significant differences were found between the probability for women to be delivered in the intervention group compared to the control group. And it brings the conclusion, a supervised physical exercise program initiated early and continued throughout pregnancy decreases the duration of the first phase of labor as well as total time of the first two phases together, and leading to a decrease in total labor time.
That physical exercise, including aerobic and aquatic exercise during pregnancy, has numerous maternal health benefits such as reduction in blood pressure, weight gain, maternal glucose, pain management, reduction in duration of labor, and others. Okay, in reality, a recent editorial highlighted the advantages of prenatal exercise based on level 1 evidence from not more than 50 randomized clinical trials, and recommended that practically all women take part in prenatal exercise. That is written by Berghella v. Sakonji 2016. The effects of exercise during pregnancy on prenatal outcomes are extremely relevant because physical activity is increasingly becoming a necessity for the pregnant population, stated by Govia R. et al. 2007.